Welcome, Medical Ward BSN 3B Group 2, third rotation NCM 116 hourly, Nursing Care Management 116 hourly, Medical Surgical Nursing 2, Virtual Clinical Duty. This is our first week, and of course, our focus today for our case scenario is patient EF diagnosed with HIV/AIDS. But before that, let me share this premise with you. I am here for you. It's literally my life's work to help you grow. And also, please allow me to share our learning outcomes for this week on completion of this case. Fourth, define the rules, 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 and the contributions of care of medical patients. Fifth, justify optimal therapy based on the current understanding of the case. So this will be our expected outcomes at the end of our case scenario. And also, please be reminded of the following instructions. All critical thinking questions presented within or after the case applies to this case study. You have to create a brief and to the point responses, no flowery words. When asked to provide several answers, it must be listed in order of priority or level of significance. Base all your answers on the data that is presented and do not assume information that is not provided in the case. Further, please follow the format of your output, especially on its font style, font size, paper margin, and paper size. So I've already given you the templates of your weekly and of course your daily requirements. So please follow that. Save it as PDF file and submit all your requirements per group on date specified as its deadline. Of course, I will not be accepting any Word file into PDF, and of course, it will be submitted as deadline. Send all your requirements via the official email address of that will be instructor and that will be given after this presentation. It is advised that you will submit all your requirements on or before the set deadline of submission because of course that will actually be incurring any point deduction if you're going to submit late. Furthermore, kindly follow this format in saving your requirements for easier monitoring. For daily requirement example, abang underscore Joseph underscore W1D1 underscore NCM 116 hourly for day 1 requirements. Other is abang underscore Joseph underscore W1D2 underscore NCM 116 hourly for day 2 requirements. For weekly requirements, please follow this format. Abang underscore Joseph underscore W1 underscore NCM 116 hourly for week 1. Let's now have case scenario of patient EF diagnosed with HIV/AIDS. Case history. Patient EF is a 36-year-old gay professional, single, a Roman Catholic in faith, and is currently residing at Barangay Kanituan, Cagayan de Oro City. He has been human immunodeficiency virus or HIV infected for 6 years. He had been on antiretroviral therapy or ART with Combivir or Yorzidovodin and Lamivudine and Nelfinavir or Veraceft. He self-discontinued his medications 6 months ago because of depression. The appearance of purplish spots on his neck and arms persuaded him to make an appointment with his physician. When he arrived at the physician's office, the nurse performed a brief assessment. His vital signs were blood pressure of 138 over 86 millimeters mercury, pulse rate of 100 beats per minute, respiratory rate of 30 breaths per minute, temperature of 100.8 degree Fahrenheit, or that's 38.2 degree Celsius. Patient EF stated that he had been feeling fatigue for several months and was experiencing occasional night sweats, but he also have been working long hours, skipped meals, and had been particularly stressed over a project at the work. The remainder of his physical examination was within normal limits. The doctor ordered a chest x-ray, CBC, lymphocyte studies, including CD4 T cell count, ultrasensitive viral load, cytomegalovirus assay, and a tuberculin tests. Over the next week, patient EF developed an unproductive cough and increasing shortness of breath. Last night, he developed a fever of 102 degree Fahrenheit and was acutely short of breath, so his roommate brought him to the emergency department of Jar Borja General Hospital. He was admitted with probable pneumocystis jirovecii pneumonia, which was confirmed with bronchoalveolar lavage examination under light microscopy. Patient EF's admission WBC and lymphocyte studies demonstrate an increased pattern of immunodeficiency compared with earlier studies. Patient EF is admitted to your medical unit and placed on nasal oxygen, IV fluids, and IV trimethoprim sulfamethoxazole or your Bactrim. Patient EF is responding well to treatment for PJP and plans are being made for discharge. His ART treatment or regimen will be restarted and he will be starting radiation treatments for Kaposi sarcoma. He will receive follow-up care at the outpatient clinic. Let's now have your high five critical thinking questions. Number 1. What is the significance of the purplish spots over patient EF's neck and arms? Again, what is the significance of purplish spots over patient EF's neck and arms? Differentiate between HIV positive status and AIDS. Again, differentiate between HIV positive and AIDS. Why is patient EF's development of Kaposi sarcoma and pneumocystis jirovecii pneumonia of particular importance in light of his HIV status? Again, why is patient EF and pneumocystis jirovecii of particular importance in light of his HIV status? Number 4, patient EF has been seropositive for several years, yet he has been asymptomatic for AIDS. What factors might have influenced patient EF's development of PJP and KS? Again, patient EF has been seropositive for several years, yet he has been asymptomatic for AIDS. What factors might have influenced patient EF's development of PJP and KS? Number 5, identify 4 problems you must manage regarding patient EF. Again, identify 4 problems you must manage regarding patient EF. Let us now have your daily requirements. For day 0, that's Tuesday, that's going to be our case scenario loading. And day 1, which is Wednesday, your basic requirement includes your GO, SO, DPA, CRA 1, Nurse's Notes 1, or your AFDAR 1. And you should have an initial knowledge about the case that includes your physical assessment, pathophysiology, diagnostic test, and also the drug study. For day 2, that is going to be Thursday, your basic requirement includes your SO, DPA, CRA 2, Nurse's Notes, FDAR 2, weekly evaluation, reflective journal reading, critical thinking answers, and initial knowledge about the case that includes your problem list, nursing care plan, and discharge plan. And for your weekly requirements, that includes your introduction, nursing health history, physical assessment, anatomy and physiology, pathophysiology, diagnostic test, drug study, problem list, nursing care plan, discharge plan, learning outcome, and references. And that has to be following the APA style of reference taking. So I have given you the templates already of this one, so please follow that. For the deadline of submission, for day 1 requirement, submission is March 24, 2021, Wednesday, 11:59 p.m. For day 2 is March 25, 2021, Thursday, 11:59 p.m. And for week 1 requirements, deadline is March 29, 2021, Monday, 11:59 p.m. We are all on our own journey, but in this class, we all need one another and will help one another grow. These are my contact details. My email is jabang@xu.edu.ph. My number is 093104298842, and of course, my social media accounts. This has been Joseph Bahian Abang at your service to make your best even better. To God be all the glory.